Hello, everybody, and welcome back to our channel. This is Nurse Eunice, and in tonight's video, we're going to be reviewing the promotion of health in the elderly. And so we'll get started in a few moments. But again, this is Nurse Eunice with Florida Training Academy, and let's get started. Promotion of health for elderly and disabled clients involves various strategies aimed at enhancing their physical, mental, and social well being, thus maximizing their quality of life. And so some of those activities could include physical activity and mobility. So encouraging regular physical activity appropriate to their abilities can improve their strength, balance, and flexibility. This might also involve tailored exercises, physical therapy, swimming, or Tai Chi. Additionally, ensuring accessibility and mobility aids like wheelchairs or walkers can help them to remain active and independent. And if you're just logging in, we're going to be discussing the promotion of health in the elderly. And in a couple of slides, we'll actually start our practice quiz. Okay, so something else that you want to monitor in order to keep your patients and your residents healthy would be their nutrition and their hydration. Providing nutritious meals and promoting hydration is crucial for maintaining health and preventing complications such as malnutrition and dehydration. Dietary plans should consider any specific dietary needs or restrictions due to medical conditions. So, as a certified nursing assistant, your patients are going to be prescribed diets. So if it's somebody who has cardiovascular disease, normally they will not have a diet that has a lot of cholesterol, a lot of fat, or a lot of salt. So they would have a cardiac diet. Similarly, your diabetics would have a diabetic diet, which would limit carbohydrates and also simple sugars. So knowing the type of diet that corresponds with your patient's diagnosis is crucial because for example, if a person who has renal disease eats something that has too much potassium, it can actually cause them to, one, need dialysis early, or worst case scenario, they can go into cardiac arrest and they can die. So if you've not actually started studying the different dietary needs for the different patient populations, I encourage you to do so. And if you need some resources, just reach out to me. All right, so preventative care and screening. Regular health checkups, screenings, and vaccinations can help to prevent and detect health issues early on. This also includes screenings for conditions common among the elderly, such as osteoporosis, diabetes, and certain cancers. We also have to monitor their medication. When you're in a home care setting, you can give medication reminders, but normally as a CNA who's working in a hospital, only your nurses would be prescribing or giving the medication, excuse me. If you're in a nursing home, it can become tricky because sometimes they will have you as the CNA take a medication administration course. And once you've taken that course, you can give medications depending on the state's requirements. So let's go back to medication management. Many elderly and disabled individuals take multiple medications, which can increase the risk of adverse reactions and interactions. Proper medication management, including medication reviews and adherence to support, is essential for their health and their safety. For example, if we have somebody who has an abnormal heart rhythm, they may be prescribed a medication that's going to thin their blood. And if they're not taking that medication, their blood can actually start clotting and they can have a stroke. So when we talk about the medication management and the medication adherence, when we have people with chronic diseases, sometimes to manage their illnesses, they have to take these medications for the rest of their life. And we want to keep reminding them and encouraging them to take their medications. And if for some reason they maybe can't afford their medication or they can't get to the pharmacy, your healthcare team will work with them to make sure they get the medicines that they need if we're notified of the issue. So Emotional and mental well being. This is especially important also. Addressing mental health concerns such as depression, anxiety, and cognitive decline is important for overall well being in your elderly patients. This might involve therapy, social support programs, or activities that stimulate cognitive function. And so when they say if you don't use it, you lose it, a lot of times we're thinking about muscles. Oh yeah, if you're inactive, well, you're going to have atrophy, your muscles are going to weak. Well, whenever someone's depressed and they're not being social, they're not interacting with others, their mentation decreases, their thrive, their quality of life also declines. So as a CNA, if you're promoting the health and the well-being of an elderly person, you want to encourage them to socialize. And if maybe they don't want to talk to others, I need you to build that bond with them so that they can at least talk to you. Right, so next, ah, good segue. Social engagement and support networks. Maintaining social connections and participating in community activities can combat loneliness and isolation, which are common among the elderly and disabled. Support groups, senior centers, and volunteer opportunities can provide valuable social interaction and emotional support. And there's actually been studies done that show that grandparents who are active and who actually, see their grandkids more often actually live longer and they're healthier. So when you think of social interactions, also think about those interactions just within the family unit, not just within the caregiving facility. Isa, congratulations for passing both of your exams. I'm so proud of you. All right, so I'll celebrate with you in a few moments. All right, environmental modifications. Adapting living spaces to accommodate physical limitations and ensure safety is essential. This may include installing grab bars, ramps, or stair lifts, as well as removing hazards and clutter. So, as a CNA, no, you're not going to be installing anything. However, if you notice that the patient's having a hard time getting off of the commode and there's not a handrail near the commode, you would alert the nurse. If it's in home care, you could alert the family and then alert the nurse, because we need to get those modifications, those additional items in that home so that we can actually help this person be as independent as possible for as long as possible. But what you can do as a CNA is you can remove those unnecessary hazards such as rugs, electrical cords. We don't want a whole bunch of clutter because the person could trip. And when they trip and have an injury when they're elderly, they can have more complications. All right, so overall, the promotion of health for elderly and disabled clients involves a holistic, so you're thinking about the entire person, a holistic approach that addresses their unique needs and challenges with the goal of maximizing their independence, dignity, and overall quality of life. And here is our first question. So, question number one. Which of the following is a common symptom of depression in elderly patients that differs from younger populations? Is it euphoria, weight gain, memory problems, or increased energy levels? So, which of those would be a symptom of depression that we normally don't see in the younger populations? And if you said C, memory problems, you're absolutely correct. So, depression can lead to forgetfulness, confusion, and other symptoms that are similar to those of dementia. Depression can also make it difficult to focus on work or other tasks, make decisions, or to think clearly. And yes, that is a correct response. Number two, which of the following is essential for maintaining proper nutrition in elderly and disabled clients? A, limiting access to fluids to avoid frequent bathroom visits. B, providing nutritious meals tailored to their dietary needs. C, encouraging ensuring meals are high in saturated fats, or D, providing only one large meal per day, because the elderly, usually, I think it says, the elderly are not as hungry as younger people. Great job, Tinkerbell. Drake, Isa, Duna, and Priya, great job. So if you selected B, you are correct. So you want to provide nutritious meals, tailor to their dietary needs. Proper nutrition is crucial for maintaining health in elderly and disabled clients, and meals should be tailored to their specific needs, which I already discussed. So make sure you look up those different dietary needs based upon your client's diseases or chronic illnesses. Number three, which factor is most likely to contribute to depression in the elderly? Is it A, high physical activity, B, strong support system, C, chronic medical conditions, or D, financial stability? Yes, great job. Yes, I see the correct answers. Yes, so you all. The correct response is C, chronic medical conditions. Chronic medical conditions such as arthritis, diabetes, and heart disease are common in the elderly and can contribute significantly to the development of depression due to pain, reduced mobility, and stress of managing multiple health issues. Think about all those doctor's appointments, trying to arrange transportation, the co-pays, etc. So that can actually, those chronic medical conditions can lead to depression. Number four, why is medication management important for elderly and disabled clients? A, it increases the risk of adverse reactions and interactions. B, it decreases the risk of adverse reactions and interactions. C, it decreases the likelihood of medication adherence. Or D, it does not affect their overall well being. Why do we want to manage their medications? Why do we want to encourage them to manage their medications? All right, we'll be revealing the answer in three, two, and yes, yes, yes. The correct response is B. It decreases the risk of adverse reactions and interactions. So, elderly and disabled clients often take multiple medications. Therefore, proper medication management, or as a CNA, those medication reminders decrease the risk of adverse reactions and/or interactions. Number five, which interventions are the most effective in reducing depression in elderly populations? Is it increasing caffeine intake, encouraging physical activity, encouraging social interactions, or increasing outdoor activities? And for this one, there are multiple answers that are correct. So let's see if you can give me all of the correct responses. All right, and I see everybody giving me one response, but there are multiple correct responses. All right, Duna, great job. So if you selected B, C, and D, you found all of the ones that actually promote emotional well being and decrease mental health concerns such as depression and anxiety. So I'll go back to the previous slide. We want to encourage physical activity, encourage social interactions, and whenever possible, remember when they're outside, the sunlight, they get vitamin D, and that affects the mood too. So if they can't go outside, if we can get them close to a window, that would also help with their mental state. Number six, a nursing assistant observes an elderly patient expressing feelings of hopelessness and a lack of interest in daily activities. The nursing assistant should A, ignore the comments and focus on physical care, B, encourage the patient to rest more. C, report the observation to the nurse or healthcare provider. D, advise the patient to watch more television. We ready? No, I didn't add an F for that one. Great job, Miller family. Great job, Paula. The correct response for this one is C. You want to report those feelings of hopelessness and a lack of interest because those could be signs of depression. And whenever you report it to me as the nurse, I will go back in, I'll speak to the patient. Sometimes they're not going to tell me things because they know if they tell me, I'm going to tell the doctor, and that's going to be a change in their care plan. So if they tell you something, sometimes I may have to go by what you say, but I will follow up, and we can either try to get group therapies. We can add different medications, some antidepressants, and usually with a combination of therapies and also a great healthcare team, we can kind of help those feelings of hopelessness subside, but it takes time. Number 7, what is an example of an environmental modification to promote safety for elderly and disabled clients? Is it A, removing hazards and clutter, B, adding throw rugs in living spaces, C, placing extension cords in each room, or D, discouraging the use of grab bars and handrails? What is an example of an environmental modification that promotes safety? And I think I see 2 correct response, Tinker and also Isa, Duna, Astride. Yes, this one was a little bit tricky. It's going to be A because we don't want those extension cords. We want to encourage them to remove those extension cords because that is actually a fall hazard. So we want to remove clutter and also any hazards such as extension cords. And those throw rugs also. Imagine someone with a walker and there's a throw rug. They're just pretty much dragging the rug along with them, and that can cause an extra reason for them to fall. Number 8, what is the impact of untreated depression on the physical health of elderly patients? Is it improved physical health, improved appetite, increased risk of physical illness and slower recovery, or enhanced cognitive function? Untreated depression. Yes, great job. So if you selected C, increased risk of physical illnesses and slower recovery, you're absolutely correct. So untreated depression can lead to a decline in physical health, increasing the risk of developing new illnesses and slowing recovery from existing conditions. Depression can also can't even say it this evening, I apologize. It can make symptoms of chronic diseases worse. All right, number 9, which of the following is a risk factor for depression in elderly nursing home residents? Is it a high level of independence, strong family connections, recent admission to the facility, or engaging in regular social activities? What's a risk factor for depression? And remember, when you take your CNA test, it's not geared to one particular location. Your CNA test, you could be working with patients in a hospital, nursing home, and or home care. So I need you to think more globally, not location specific. And yes, it is going to be C. So, whenever someone is recently admitted to a nursing home, they're anxious, they're nervous, and sometimes they're not easy to work with because we took them out of their home because maybe they need assistance with their medications. The person can't see how much insulin to administer to themselves. And so now we have to institutionalize you, and we have a CNA who wakes you up every 4 hours and who tells you what time to take a bath, and the food is nasty. So they usually will have some signs of depression until they get adjusted to the nursing home. But the person who makes the biggest difference and the biggest impact is our nursing assistants, because again, you're the one who spends the most time with them and you're going to help them adjust to the facility. Number 10, which statement about depression in elderly men is true? A, elderly men are less likely to report symptoms of depression. B, depression is more common in elderly men than in women. Elderly men are more likely to seek help for depression, or elderly men are unaffected by social isolation. Hmm, right? I give you all about 3 more seconds before I reveal the answer. And yes, Paula, it is A. Elderly men are less likely to report symptoms of depression. And that's mainly due to social expectations. When you think about social circles, you usually see women hanging together, even the older women. They're going out on trips. And where is Papa at? He's on the couch with the dog. So maybe you want to encourage them to socialize a little bit more, but you can look for the signs in the elderly men. They usually won't verbalize it as much as a woman would. So if they're not eating, if they are losing their interest in doing something that they previously enjoyed doing, that could be a sign of depression. Number 11, which of the following is an effective way to monitor hydration status in elderly patients? Is it checking skin turgor, observing for hair growth, measuring weight daily, or monitoring sleep patterns? How do we check hydration status? And I see a lot of correct answers. I'm so proud of you all. It's going to be skin turgor. So if you look at the skin, it's dry and it's wrinkled. That is a sign that the person doesn't have enough hydration. They need more water. So you can put lotion on top of their skin topically. That's not going to really help them. They need moisture on the inside too. So this would be a way to improve their skin turgor, would be to encourage fluids and to use external moisturizers such as lotion. So, skin turgor is a useful clinical indicator of hydration status. Poor turgor can indicate dehydration, which is particularly important to monitor in your elderly patients. And if you watched our video yesterday about the differences in the colors of urine and stool, you'll know that when someone's dehydrated, not only would they have a decrease in skin turgor, but they will also have changes in their urine. Number 12, what is a common barrier to adequate fluid intake in the elderly? Is it an overactive bladder, increased appetite, lack of access to beverages, or enhanced sense of thirst? No answers yet. You're thinking about this one. All right, I haven't seen a correct answer yet, so we'll reveal the answer in 3, 2, and this was tricky because you're thinking as a CNA, well, they're going to have access to beverages because I'm going to bring it. But remember, for your test, the patient isn't limited to a nursing home or a hospital. They could actually be in their own home. So they may have limited access to beverages, whether due to mobility issues or cognitive impairments. And that can be a significant barrier to adequate fluid intake. So, yes, in a nursing home or a hospital, you have the water pitcher right there filled with water. But when they're at home, they may not have it just sitting in front of them, or they don't have someone to remind them to drink it as often as they should. Number 13, to stimulate appetite in elderly patients, nursing assistants can serve meals in a busy, noisy environment, offer a variety of foods with different flavors and textures, restrict food choices to avoid confusion, or serve meals at irregular times. So, not regular, irregular. Let's see, this should be an easier one. Let's see what answers you have for this one. Yes. Great job. So you want to offer a variety of foods with different flavors and textures. And so if we know that a person is having issues with swallowing or with chewing, let's start with chewing. Make sure that your patients have the right dentation for their diet. For example, if Papa doesn't or Mr. Jenkins doesn't have his dentures, he should not be eating a hamburger. You're the CNA, you're in the room with him, you're going to have to cut that hamburger up. And then after that, you're going to let me know that he doesn't have his dentures. I'll do investigation. I'll see if the family can bring the dentures. And if not, I'm going to contact the doctor because we have to modify his diet. So it may not be that he needs a pureed diet or something as thin as a soup, but he won't be getting a hamburger. So maybe like Salisbury steak and a bun on the side. But based on the patient's needs, we can do a parade diet. We have to sometimes thicken their fluids. So you working with your patients and having foods from different textures is going to benefit them and help them to enjoy their food and to eat enough food. Number 14, which nutrient is particularly important to monitor to prevent muscle wasting and weight loss in the elderly? Is it carbohydrates, fats, protein, or sugar? How do we prevent muscle wasting? Yes. I would turn on my camera, but I would scare you all. It's after midnight here, so so yes, I'm so proud of you all. It is C, protein. So protein is crucial for maintaining muscle mass and preventing muscle wasting. Adequate protein intakes helps individuals maintain strength and body weight. It also decreases pressure sore occurrences. So if your patient's losing muscles and losing mass, they're going to be more likely to develop a pressure sore. And if someone says, well, hey, I'm a vegetarian, they can still have legumes, they can have supplements that don't actually contain any meat or meat products. So there are multiple ways for them to get the protein in their diet. Number 15, which of the following is a sign of dehydration in the elderly? Is it clear, pale urine, increased energy levels, dry mouth and sucking eyes, or regular bowel movements? A sign of dehydration. And Michelangelo, Paula, Miss O, Miller family, you all are absolutely correct. So, the dry mouth and sunken eyes are common signs of dehydration. Elderly individuals may not always recognize their own thirst, so these physical signs are important indicators. And you all, the reason why I came on here so late tonight instead of doing this tomorrow is because I wanted to say thank you. Guess what, team? We still have another question, but let's read this question. I'll tell you all the great news. So, number 16, how can education and empowerment contribute to the health of elderly and disabled clients? Is it by limiting access to information, by providing information and resources to empower them in managing their health, by avoiding discussions about their health conditions, or by discouraging them from taking an active role in their health care? Yes, yes, yes. So that's what we do. We encourage them to take care of their health. Your nurse goes in and does the initial education, and then you reinforce. Every time you come in that room smiling, you come in that room smiling and pouring some water into their cup to remind them to drink some more fluids. So, you all, this is the great news. Well, great news number one is that Issa passed her CNA test. So, congratulations. And then, great news number two is that we finally have 500,000 subscribers. So we reached our goal. We could not have done it without you. So I just thank you all so much for supporting, for engaging, and for, most importantly, caring for God's people, because that's why I do this. I come on here. I want to make sure you pass your test. I answer your questions because we need more caregivers who care. So thank you all. I know I appreciate you all. And I may have said the name wrong. Is it Isa who just passed her test? Thank you, thank you, thank you. Well, you all, I teach my classes this weekend at Florida Training Academy. So I have our weekend CNA classes. So I may not come back on until Monday, but you all have a marvelous weekend. Enjoy time with your family. Happy studying. And if you need anything, if you have questions, I'll put our email address in the chat, but I may not be able to respond to those emails until Monday. And that's admin@fltraining.com. Have a good weekend, everybody, and bye. Good night.